Hey everyone, Nurse Jen here. If your pediatrician has talked to you about a GLP-1 medication for your child, or you've been trying to get one approved and the insurance company keeps pushing back, this video is for you. Today we're walking through pediatric GLP-1s, when they're actually warranted, what the prior authorization process looks like, where families get stuck, and how to push back when the insurance company says no. First, the basics. A handful of GLP-1 medications are FDA approved for pediatric use. For chronic weight management in adolescents 12 and up, Saxenda and Wegovy are the two main ones. For type 2 diabetes in children 10 and up, you'll see Victoza and Trulicity. The newer drugs you've heard about in adults, like Ozempic and Mounjaro, are not approved for pediatric weight management at this time. So when are these medications actually warranted? The American Academy of Pediatrics released updated clinical guidelines in 2023 that recommend considering pharmacotherapy for adolescents 12 and up with obesity. That's a BMI at or above the 95th percentile for age and sex, alongside intensive lifestyle and behavioral treatment. The key word there is alongside. These medications are an addition to lifestyle intervention, not a replacement for it. Comorbidities like type 2 diabetes, high blood pressure, sleep apnea, or fatty liver disease typically strengthen the case. Almost every commercial insurance plan requires a prior authorization for a pediatric GLP-1. What they want to see varies by plan, but the core requirements are usually FDA-approved indication, age and BMI documentation in pediatric percentile terms, comorbidities listed, and proof that lifestyle intervention has been tried. Now here's where most families get stuck. Step therapy. Most plans require documented evidence that your child has been actively engaged in a comprehensive lifestyle intervention, typically 3 to 6 months of supervised diet, physical activity, and behavioral counseling before they'll approve the medication. Some plans also require a trial of metformin first, especially if there are signs of insulin resistance or type 2 diabetes. This is the single biggest hang-up I see. Families know themselves that lifestyle changes have been ongoing, but the chart documentation doesn't capture it the way the insurance company needs. The other common hang-ups. BMI is documented as a number instead of an age and sex-specific percentile, which insurance auditors require. Comorbidities aren't fully documented even when they exist. Baseline labs, fasting glucose, lipid panel, liver function aren't submitted. And sometimes the prescribing provider isn't recognized as a qualified prescriber under the plan's criteria. Any one of these can cause a denial. If your prior authorization is denied, and many initial requests are, here's what works. First, the medical necessity letter from your provider should specifically cite the AAP 2023 guidelines on obesity treatment, document the BMI percentile and trend, list every comorbidity, and detail what lifestyle interventions have been tried and for how long. Second, request a peer-to-peer review. That's your child's prescriber speaking directly to the insurance plan's medical director. Peer-to-peer reviews are where many of these denials get overturned. And third, if internal appeals fail, you have the right to an external review by an independent organization. That's an underused option that bypasses the insurance company entirely. And here's where we come in. At Precision Pediatric Operations, this is the kind of authorization we manage every day. Strengthening the initial submission, organizing the documentation, requesting peer-to-peer reviews, and walking through the appeal process when the initial answer is no. Most denied GLP-1 requests aren't denied because the child doesn't qualify. They're denied because the paperwork doesn't tell the full story. Our job is to make sure it does. GLP-1 medications are a real option in pediatric care when they're medically appropriate, and getting them approved is a navigable process. It just takes the right documentation and the right pushback when it's needed. Important note, I'm a nurse, and this is general educational information, not medical advice, and not a recommendation for or against any specific medication. Whether a GLP-1 is right for your child is a decision between your family and your child's care team. Always confirm specific coverage requirements with your own insurance plan. If you're trying to get a pediatric GLP-1 approved or appealed, head to precisionpediatricops.com or call us at 540-223-4565 for a free consultation. If this was helpful, like and subscribe, and share it with another parent navigating the same process. See you on the next one.